Hi everyone, Dr. Vipul Shah, Clinical Director of PAC Health here with your weekly COVID-19 update, shot directly from my home studio. Hope everyone's doing well. I know we're about a month into this quarantine, which is getting harder, but it's an important thing that we all have done, and we all deserve a big pat on our backs for taking care of each other and taking care of ourselves and the most vulnerable in our population. So good job and keep it up. The main news for this week is going to be surrounding certain places that are relaxing some of their social distancing and stay-at-home orders. Depending upon where you live, your state governments may be starting to lift some of the more strict guidelines about staying at home. Recognize that this is not a national policy relaxing these guidelines, so really pay attention to what's happening locally. So if you are in one of these areas where you are able to go out a little bit more, make sure that you're still following all the other recommendations about staying 6 feet away from people, wearing a mask when you're out in public, and washing your hands regularly. Also know that some of the things that you're used to may not be the same as they were before the coronavirus. Things like there are going to be fewer people in the restaurants that you may go out to, or there may be different requirements about how close people can sit to other people and how you can interact with people. So just be aware that we are in a time where this is just a trial of reducing the social distancing rules to make sure that we don't have a rebound of the virus, because we do know that the virus is still spreading in the population. So today's main topic is going to be about substance abuse and the risk of substance abuse during the pandemic and during this quarantine time. I'm not an expert in this, so we've actually asked an expert in the field of addiction medicine and addiction psychology to come help us today and talk a little bit more about their perspectives on this. So this week we're honored to have Dr. Peter Hendricks here with us from UAB. He is an expert in addiction medicine, and he is going to be talking to us a little bit about substance abuse during the COVID-19 crisis. So Dr. Hendricks, thanks for joining us.
Thank you for having me.
So we just wanted to start out by is there any research that's out there about major social disruptions and the risk for substance abuse and addictive behaviors?
We're holed up. We are perhaps a little stir crazy. We're bored. Maybe we're feeling a little anxious about what the future holds. And the leading theories of addiction would state that the main motivation to use is to escape or avoid negative feelings, right? So when we feel sad, we are at higher risk to use. When we're feeling anxious, we're at higher risk to use, and so on. So one concern is that people are inside and anxious about their financial future, about the future of public health, of life on this planet, that they might be at higher risk to use a variety of substances as a way of coping with these feelings.
So if you have a coexisting mental health condition, things like depression or anxiety, the worsening of those symptoms can lead to relapse, as can social isolation, stress, and boredom. Question 2. Does the coronavirus pandemic present any specific challenges for those who are dealing with the substance abuse disorder?
I'm not sure of any empirical trends at the moment, but I think a concern is that people who need these medications may not have access to them. If the medical system is overwhelmed and overburdened, it may be that some of these patients are triaged, essentially, right, kind of put on the back burner and not able to access their medication. And that's a big concern, especially for opioid dependence.
So based upon what we just spoke about, all of those risk factors are going to be heightened right now during the coronavirus pandemic. We all are in social isolation. There's a lot more time on people's hands. People are facing a lot of very stressful situations. People have lost their jobs. They're having financial difficulties. So these are all heightened risk factors right now. So that is why it's very important to stay vigilant about your recovery and to reach out for help if you need it during this time. What are concerning behaviors that people should be aware of?
If they seem withdrawn, if they're not quite themselves, if they're irritable, if they seem to be feeling kind of sad or blue, their energy is low, they're sleeping much longer than usual or sleeping much less than usual. They're not sort of enjoying the things they typically enjoy. We call this anhedonia. These are big concerns as well. If someone seems especially anxious and worried, if they're perseverating, if they're concerned about the same thing, and they can't seem to sort of break out of that cycle of worry. These are all concerns too.
So if you or your loved one suffers from a substance abuse disorder or in recovery, it's important to know what behaviors that could be signs that you're at risk of relapsing or abusing substances again. So the things that I spoke to my colleagues about, they mentioned are worsening signs of worsening control of your mental health condition. So if you have a dual diagnosis of addiction and depression or anxiety, if you're finding that your mental health is not being well taken care of, that's certainly a risk of relapse. So if you have depression, things like anhedonia, so lack of joy, trouble sleeping, trouble eating, all of those symptoms that we know are associated with major depressive disorder, if they're starting to show up right now during the pandemic, then that's certainly something to be watching out for, not only for the depressive side of your mental health, but also for your addiction side. So that's important. Anxiety, if people are perseverating, having a lot of hard time concentrating, things like that are also things to watch out for. If people have a history of, if you or your loved one have a history of alcohol abuse, there are certain validated questions that physicians ask. They're called the CAGE questions, which have you ever thought about cutting back? Have you ever gotten annoyed when somebody asks you about your drinking? Do you feel guilty about your drinking? Or if you ever have an eye opener, or in order to avoid withdrawal symptoms or just have a drink early in the morning, these are all signs that you may be using alcohol inappropriately, and it may be worth thinking about getting help during this time. Making sure you realize how much you're drinking on a daily basis, and if it's a lot more than you normally would, you certainly are putting yourself at risk. And remember, all of these substances put your immunity at risk, and I think Dr. Hendricks has a good statement about that.
Smoking, vaping, inhaling anything is going to compromise your immune system. As we know, COVID affects primarily your respiratory system. Virtually anything you inhale is going to lead to an inflammatory response. It's going to make you at higher risk for COVID and complications of COVID, and much of the data that we've seen so far indicates that smokers were adversely affected by the coronavirus. And if we weren't in this time now, I would say, women have a drink per day, men have 2 drinks per day, but I think at this point I'd say even 1 drink per day is a concern, because alcohol is an immunosuppressant, and it's going to not allow your immune system to do what it does as well as it does.
Are there any strategies you would recommend for those with a history of substance abuse to help them avoid relapse?
I think now more than ever, people need to probably have something of a routine, right? I always advocate that people make themselves a schedule of sorts, so they know what they're doing throughout the day. And you can schedule downtime, that's fine. But I would say, get up, shower, get dressed, and schedule your day, pack your day with enjoyable, meaningful activities. Schedule phone calls, schedule Zoom calls. If you live with people, there are certainly enjoyable things you can do with each other that don't involve looking at a screen. You can take walks. Physical activity is a wonderful way to regulate mood. And I think, moderate physical activity, if you're capable of doing it, is a great idea, especially, again, if it conforms with our social distancing guidelines. So taking walks through your neighborhood, working out inside, these are great ideas. And, not that it's the easiest thing to do, but I think meditation could be something that we could all be practicing at this point, because we have a lot of time, and perhaps for some of us, a lot of silence. And meditation is a wonderful thing for your brain. It's something that we should all be doing. So this could be the time to try something new.
So I think Dr. Hendricks has a great segment about what he would recommend. And I think things like meditation or mindfulness are proven strategies for helping with some of the negative emotions that come during these time periods. So really following some of the advice we've given previously on managing your mental health, things like exercising, eating healthy, sleeping well, these are all non-pharmacologic measures to try to help you manage some of this, try to use different coping mechanisms other than substance abuse. The other things that we've talked about are making sure that you do try to connect with your social networks that you have used in the past. So if you are a member of AA, or you're using NA, or you have any other support groups that you're using, make sure that you do reach out to them and see if they have virtual meetings available. What resources would you recommend for anyone who struggles with or has a loved one who struggles with substance abuse during this pandemic?
I think the first point of contact would be that primary care provider, if you have one. Contact that primary care provider's office and inquire as to support that might be available at the hospital or that office, to contact local 12-step support groups like Alcoholics Anonymous and inquire as to whether meetings have moved online. Mm-hmm. And a lot of these things would be organized locally. So if you're someone who had been attending physical, let's say AA meetings or support group meetings, the first thing to do is to call the leader, to email the leader, to go to that website and see if they're now meeting online and do so. Often our families and friends are sort of that first line of care for mental health. Reach out to your parents, grandparents, siblings, children, grandchildren, friends, anyone and everyone to get that social support you need.
There certainly are a lot of resources out there right now, but they're different than what you were used to probably. So Alcoholics Anonymous and Narcotics Anonymous are holding online meetings. And if you have other social support groups that you've been a part of in the past, definitely check and see if they're holding any online or virtual meetings. Also, reach out to people you love or people that you trust. That's an important thing to do right now to avoid the risk of worsening social isolation and loneliness during this time. And if you know somebody who suffers from substance abuse or is at risk, please stay in touch with them, give them a call. This is a really important time for you to be a good support for people that you love as well. Take care of your mental health, and if you need any resources on that, please look on packhealth.com. And also, if you do find that you're at a place where you need treatment, there are treatment centers that are open during this COVID pandemic. So reach out to your health advisor, reach out to your providers, and see if they can help you find a treatment center if that's really where you're at right now. Of course, there are also the national hotline for substance abuse, which we will display on the screen. So call that number if you need any help. But don't be afraid to look out for resources and don't be afraid to ask for help during this time. Thanks again to Dr. Hendricks for being here with us. We really appreciate all of his insights and all of his very helpful tips. That wraps up our segment for today. Remember, if you need anything, please reach out to your health advisor. That means things like getting groceries, getting medications, or just help with some of these resources we talked about, or even if you just need somebody to talk to. Remember, we're here for you. Stay safe, stay healthy, and we'll see you soon. Take care.